I'm Miss by Almera Iberwar, your RT intern, and today I will perform a return demonstration in administering nebulization. So first, all we need to do is to verify the physician order and to review the chart of the patient. By verifying the physician order, this is to be able to check if the medication is right before administering it to the patient. And by reviewing the chart of the patient, this is to be able to identify who the patient is and where the patient at. So, as I can see in the doctor's order, Mr. De La Cruz will schedule to nebulize at this time with the medication of salbutamol. So, every 6 hours. So, in reviewing the patient's chart, patient name is James De La Cruz, age 65 years old, sex male, and room or ward number 101. So, after that, we will gather all the required equipments and check if the medication is available, and will also ensure that the medication expiration date is current. So, first, before gathering the equipments, we will first check if the medication is available. So, as we can see here, the salbutamol medication for nebulization is available. So, let us check. The medication is right. It is salbutamol, and also the expiration date is current. So, after that, we will now gather the other required equipments for nebulization. So, we have here a nebulizer compressor, a chamber with a baffle inside, a connecting tubing, and as well as the face mask. And lastly, the medication as per doctor's order. So again, before bringing it to the bedside, we should check if the medication is right and the expiration date is current. So since again it is the medication I prepared is right and the expiration date is current. So after gathering all the equipments, we will now bring all the equipments to the patient bedside. Then after that, we will do privacy or give privacy and provide privacy and do hand washing. So by doing hand washing, this is to deter the spread of microorganisms and to avoid infection. So since my hand is somehow clean and spotless, so I will just perform a dry hand washing with the use of alcohol. And after that, I will now identify the patient and introduce myself to the patient and explain the procedure to the patient. So, by explaining the procedure to the patient, this will promote a good cooperation of the patient in the administration of nebulization. So, hi tay, maayong buntag. Ako di ay ang RT on duty, karon tay, ako si Miss Berwar tay. So, kumusta man ta tay? Naglisod ta ginhawa? Okay. So, unsa ganito imong pangalan tay? Okay, si Tatay James, ninduta din ni mong pangalan tay. Oy, pila na gani edad na to tay? 65 years old. Okay. Hinay ba akong tingog tay? Um, kusog. Kusog di ay. Sige, sige. Okay tay karon tay, nebulize ti ka tay. Para mugaan na imuhang pamati kay naglisod man ka kaginhawa. Nebulize ti ka tay. Nakasulay na ba kag nebulization tay? Kanang mag-aso-aso ba? Ikaduha na ni Moron. Okay. Kamusta di ka na-admit tay? Gahapon. Okay, tama ka tay. Gahapon ka na-admit. Okay, so, ako ang gimon karon nimo tay is mag-nebulize ta tay para mo maayo na imong pagginhawa, para maayo na ta tay. Okay. Para dili na ta magluya-luya ba? Okay tay? Sige. Okay ra tay? Okay ka tay? Okay ra ta tay? Sige. And after identifying the patient, we will now position the patient into the comfortable sitting position or semi-Fowler's position. So, tay, lingkod lang ta tay ha. Para ka nang komportable na po tay. Makalingkod ba ka tay? Maglisod ka. Sige lang, sandig na lang tay diri sa lugnan. Anak tay, okay na, comfortable na ta? Okay. And after that, before starting the nebulization, we will first assess the patient by getting his heart rate. So, tay, i-assess sa kanako tay ha before ta mag-start sa nebulization para mahibaw-an ako kung say effects sa nebulization nimo after nighuman tay ha. Mag-check lang ko tay. Relax lang ta tay. So, after that, we will now start preparing the nebulization. By preparing the nebulization, first, we should plug the nebulizer compressor to the power source. And after that, we will prepare the medication. And again, before putting the medication into the chamber, first, we should check that if the medication is right and the expiration date is correct. So again, the medication is right and it is salbutamol and the expiration date is current. So after that, we will now be putting the medication to the chamber. And then after putting the medication to the chamber, we will now get the connecting tubing, connect the end of the tubing to the chamber with the baffle inside. And then the another end of the connecting tubing to the nipple of the compressor. Then after that, we will now put the face mask to the chamber. But before that, we should instruct the patient first that in the middle of the medication, the patient should do several deep breaths in order for the medication to go to the all parts of the lungs and to be able to the medication to be more effective. So, tay, mag-start na tag nebulization tay ha. Kuantay ka ng instruct lang ko nimo tay ha na maginhawa taglalong tay ha and mag-start na ta sa atong nebulization para parang tambal tay mo sulod jud sa imong lungs. Pero dili lang pud kayo pug sunog, ginhawa ka ng sa makaya lang tay ha. Ginhawa taglalong, sige. Okay tay. After that, we will now turn on the compressor. Then, before putting the face mask to the patient, we should observe that the mist is present. So, since as we observe that the mist is present, we will now put the face mask to the patient. By putting the face mask, we should put the face mask over the patient's nose and mouth and secure the elastic strap comfortably. Normally, nebulization takes up to 15 to 20 minutes before it's done. So, in the middle of the nebulization, since I already told the patient to do deep breathing, now I will just observe the patient's chest expansion. Ginawa taglalong tay. Very good. Okay. Very good kay si tatay ay inawag lalong. Okay. After that, if you will observe that when the mist stop but there's still a medication clinging in the side of the chamber, you can tap it and then the mist will start again. Okay, tay. Inhawag lalong, tay. Very good. So, in the middle of the administration, you should encourage the patient to do several deep breaths and facilitate coughing techniques. So, kaubuhan ka, tay. Ubo lang, tay. Kay hapit naman mahuman na tong kuan, tay. O, nebulization. Gamay na lang kulang, tay. Note that in the completion of the treatment, there might be increased secretion and cough. So, okay, tay. Humana na ta. Wala undang na ang aso. Humana na ta, tay. Very good jud kay si tatay kay kaning higop jud niya tanan ang aso. Sulod na jud to sa lungs tanan nimo, tay. Ako nang tangtangon, tay, ha. Very good kayo si tatay. After turn off the nebulization compressor, we will now pull out the plug of the nebulizer compressor to the power source. And after that, if the secretion increase, assess the patient for suction. So since our patient has have just a normal secretion, we will now proceed to assess the patient, pertinent assessment findings, just like to monitor the patient's heart rate. So, mag-check sa kog heart rate nimo tay ha. By checking the heart rate, this is to be able to identify if the patient affects the medication effects to the patient, because as we all know that bronchodilator may cause tachycardia, palpitation, dizziness, nausea, or even nervousness. So tayo mag-assess na ko tayo ha. Ginhawa lang, normal lang ginawa. Kaubohan ka tay? Ubo lang, ubo lang. Dili lang pod kayo pugso ng ubo ha. Okay, tay. Thank you. Kaubohan ka, tay? Ubo lang. Sige lang. Kaya nahumok na guro na yung mga plema, tay. Sige. So, mananata, tay. Salamat kayo, tay, ha. Oh, unya na pod. Mag-nebulize na pod taon niya. Pero, dili na ako. Lahi na pod ang mag-nebulize nimo. Ugma na pod na magkita, tay. Sige. Salamat, tay. Very good kay si tatay. So, after that, we will now do aftercare of the equipment. So, in doing aftercare of the equipment, we should clean all the equipment. So, should wash the connecting tubing with water as well as the baffle, and also disinfect the face mask for the later use. Then, after that, we will now document the time of the medication started, as well as the medication used, also the description and the amount of the secretion, and also the response of the patient to the therapy. Because written summary provides a accurate documentation of the care and response of the patient to the treatment. Then, after that, we will now again do hand washing. This is to be able to deter the spread of microorganisms and to prevent infections. Just to be clarified, we will do first the hand washing before we document the what we observe the patient before we do the documentation. So first, we do hand washing, so that while documenting the results or the observation of the patient, we will not be infected since we already done in our hand washing. So sorry for that. So first we should do the hand washing after the documentation. And that's all for today. Thank you so much.